Alright guys, so we'll be looking at some couple of cancers that actually would affect the lungs. Alright, so we'll be looking at the bronchogenic cancer. This one will be affecting the bronchioles. Then we'll also look at what? The carcinoma of the lungs. Or you could just say what? The lung cancer. Alright. So yeah, everything affects the lungs, alright? But the two disease condition actually what? Affect the lungs to different extents, okay? And that's what we kind of like be looking at in this lecture. So looking at the bronchogenic cancer and the carcinoma of the lungs, I'll look at it under what? The types, okay? From the definition, we'll look at the types, we'll look at the causes and risk factors, we'll look at the symptoms, we'll look at the diagnosis, we'll look at the treatment options, we'll look at the prognosis, look at the stages, look at the prevention, okay? So it's quite a bulky concept, but we'll see how we'll be able to go through it. All right. So we said that this bronchogenic cancer and carcinoma of the lungs or lung cancer, it actually refers to what? Uncontrolled growth of cells in the lungs. Okay. Either bronchogenic or carcinoma of the lungs, it actually means the same thing if you ask me. Okay. So it is actually what? A leading cause of cancer deaths worldwide. Okay. So most people that have this disease condition, the prognosis is kind of like low because the lungs control all those breathing. And if you have cancer in the lungs, then you're actually going up. All right. Then talking about the types, we have the non-small cell lung cancer, non-small cell lung cancer. This one is a small cell cancer. All right. So non-small cell cancer, we can also say the large cell cancer, right? So the non-small cell cancer, we have examples include what? Adenocarcinoma. It could be squamous cell carcinoma. It could be large cell carcinoma, just like we have here. All right. Then looking at the small cell cancer, which we have here, this one is also known as what? Oat cell carcinoma. All right. Also known as what? Oat cell carcinoma. All right. Then looking at the causes and risk factors. Okay. Which type of lifestyle could you be practicing that will predispose you to having this disease condition? All right. So if you're a smoker, you are the risk. If you do secondhand smoking is more of like, okay, you are not really smoking directly, but you are where people smoke and all the stuff, right? Then radon gas exposure, asbestos exposure, air pollution. If you have a family history, like people in your family suffer from this condition, that's like genetically linked, right? Then previous radiation therapy, so there's a risk for this, right? Then talking about the symptoms of this condition, yeah, you'll be having persistent cough, you'll be having chest pain or discomfort, you'll be having shortness of breath, you'll be having wheezing or coughing of blood, you'll be having fatigue, you'll be having weight loss, you'll be having reoccurring what? Lung infections. Okay, so that means you'll be having lung infections, be coming, they treat it, it goes, later it comes back and all that. All right, that's because there's an underlying what? Cancer. Then talking about the diagnosis, right? Of course, the lungs is buried deep down there into the chest. So you might want to do some imaging tests like CT scan, PET, MRI scan, just to what? Have a view of the internal environment. Then biopsy. You could do what? A fine needle aspiration, biopsy. Then you can also do what? Sputum cytology. All right. Then talking about the treatment options, you could do things like what? Lobectomy, pneumonectomy. Then you could also do radiation therapy, chemotherapy, targeted therapy, immunotherapy, and palliative care. Right. Then going on to talk about the prognosis. Prognosis is like what? The likelihood of the patient recovering from what? A certain disease condition. And this one, the prognosis just depends on the stage, depends on the type. Either is a small lung cancer cell, all right? Is it non-small, okay, and all that. Then early stage lung cancer has a better prognosis than the advanced stage, okay? Then stages. Local stage one, yeah, I'll be having a proper video on this on the TNM classification of cancers. Stage 1, there's a tumor but it's just localized, right? Stage 2, the tumor is now spreading to the nearby lymph nodes. Stage 3, the tumor is now spreading toward distant lymph nodes. Stage 4, there's metastasis toward other organs. Okay. Then prevention. You have to quit smoking, avoid secondhand smoking, like staying where other people are smoking, right? You should always test for radon gas. Okay. They should avoid exposure to asbestos. You should wear protective gear in what polluted area. Okay. So that's it about the concept of what um, bronchogenic cancer, or you could say carcinoma of the lungs or lung cancer. See you guys pretty soon.